Now let's hear more about the adverse effects on this from Siddharth Chatterjee, the United Nations resident coordinator from Kenya. Now, Sid, thousands of people are homeless, either from war, flash floods, or evictions. How are Africa's homeless coping?
Well, thank you for having me first on your program, Sharon. And perhaps COVID-19 has come at a time where it has actually exposed the world's greatest vulnerability, and that is public health. And as we can see that from the east to the south to the west to the north of the world, no one has been spared the catastrophic impact that this COVID crisis is having, not just on people, on public health, but on economies as well. When it comes to people, one of the things that Africa is doing perhaps much better than the rest of the world is that we've still at around 150,000 people that are infected and less than 4,300 dead as we speak. But Africa's win is going to be through the prevention angle. And prevention will mean flattening the curve through all the social media messaging, ensuring hand washing, ensuring proper hygiene and respiratory etiquette, ensuring wearing of masks. Now, during this time, there are going to be difficulties. There's no doubt about that, as people are experiencing difficulties elsewhere. For example, in Kenya, we are looking at a humanitarian trident, a triple crisis. We have the COVID-19, we have the floods, and then we have a locust invasion, which is best described as one of biblical proportions. And this could potentially lead to increased food insecurity and hunger. Now, this is happening in all of sub-Saharan Africa. It is happening in many parts of Africa. But I think the world needs to understand that Africa will not be able to cope with the kind of ravaging of the pandemic as we've seen in what I would term as the Big Five, the United States, the UK, France, Germany, Italy. It's been very, very difficult there. Despite the fact that these are advanced countries with incredible health systems, they could not cope with that magnitude. And therefore, for us, as the UN family, working with the governments all over Africa, what we are trying to do is to prevent, is to flatten the curve through the prevention angle. There are people that are getting displaced because of the floods. It is a challenge, no doubt, because in COVID-19, we have to keep safe and physical distancing while we are getting people out of harm's way that is being caused by the floods. It contradicts because it's bringing people together. As a result, community transmission is expanding. And that is precisely why the UN family is working with governments, with civil society partners on how best to collectively address this contradictory kind of humanitarian crisis. Topped up with the locust invasion, we are in a difficult patch, but trust me, the UN all over Africa is in lockstep with their government, working together tirelessly to make sure that we can actually flatten this curve. Over to you, Sharon.
Right, but Sid, let's talk about the homeless people who've been evicted and those that are fleeing areas of conflict and locusts. What's happening to these people?
It is unfortunate. And, our message as the United Nations is there must be no evictions. There must be no forced evictions. But there are people getting evicted as a result of the floods, no doubt about that. And that is increasing vulnerability. So, organizations like UNICEF, UNHCR, UNDP, WHO, all working hand in hand to make sure what kind of temporary shelters we could arrange in concert with the governments, because we still have to maintain the social, the physical and safe distancing. We do need to maintain and ensure that people have access to clean water and hand sanitizers and good soap, so that they are able to prevent the infection spreading inadvertently from their hand to the mouth. So it's very multifaceted, it's very multidimensional, and this is perhaps one of the biggest challenges post the Spanish flu of 1918 to 1920 that the world is confronting. What we need to be doing is working in lockstep, in partnership, and our priority right now is the humanitarian imperative. As the UN's Deputy Secretary General has said, this is not just a public health emergency. This is a humanitarian emergency, and it's a development emergency. It is causing such levels of poverty all over the world. I mean, WFP is talking about 265 million people who are marching towards starvation by the end of the year. We have a challenge in front of us, but if we all come together and work together on this, in my view, it may be slightly biased. I think Africa is doing well. if Africa's leadership, the political leadership, understands that the best way is to prevent, the best way is to make sure that the partnerships are able to unfold, reach the last mile, reach the furthest behind first. Because if we leave anybody behind, as the COVID pandemic has shown, any nation state, any county, any village which has a weak health system, that is the weakest link in terms of universal health coverage. So I think we now have a collective resolve of how to move this agenda forward. Over to you, Sharon.
So, Sid, you really believe it's possible to keep this population safe in the current conditions with an ongoing pandemic?
Absolutely. The thing is that today temporary shelters are possible. Today the issue is how do we work together to make sure that the real estate is made available, the facilities are made available, whether it's tented accommodation or anything else. That is precisely the kind of planning we are doing here. The rains haven't gone away. In fact, we are going to be seeing increased vulnerability, for example, in Kenya and sub-Saharan Africa to increase flooding. What do we do with these populations? We have to make sure that the humanitarian imperative becomes the overriding factor. This is about saving people's lives. We have to make sure that we do everything possible to do that. Over to you.
So, Sid, what lessons and solutions can Africa extract from its COVID-19 response?
Sharon, I think this is best described by a Greek philosopher by the name of Herophilus. He said that when health is absent, wisdom cannot reveal itself, art cannot manifest, strength cannot fight, wealth becomes useless, and intelligence cannot be applied. What this pandemic has shown is the universality, the vitality, the urgency of ensuring universal health coverage. I commend President Kenyatta of Kenya for having prioritized and made universal health coverage a priority for the country. I think this is precisely what we need to do throughout the world, is to look at Sustainable Development Goal number 3, which is about universal access to quality healthcare, becomes universal in the real sense. Because what it has shown is if health is gone, everything else falls apart, just as I quoted Herophilus said. And to me, there are a few critical things that need to happen quite urgently. And these are, number one, is governments need to prioritize public health and put that in at the top end of their listings or priorities or what needs to be done. They need to invest more in community health workers and in the healthcare system, the healthcare human capital. Make sure that the health workers actually deserve the same kind of recognition like armed soldiers go when they go into battle. These are people who are working tirelessly and selflessly in preserving life. We need to make sure that we have a fit for purpose health insurance system that covers the entire continent. We need to forge new forms of public-private partnerships to make sure that wherever there is a weak link, that is kind of covered up. Because what this pandemic has shown, and for the world to learn lessons, is we need to prioritize public health. And that is where multilateralism, the importance of the UN system, the World Health Organization, all coming together, working with governments, working with civil societies, forging new public-private partnerships, and ensuring that we use big data, technology, and innovation to leapfrog universal health coverage. And frankly, it's doable. I think when I serve in a country like Kenya, which I'm privileged to as the resident coordinator, there were certain early actions that the government took. I think the president was decisive. Your minister of health was decisive. They quickly brought partners together. We came around the table. For example, the government of Kenya and the United Nations system came together as early as the 20th of March to look at what is it that we could do to make sure that we had a robust response. The UN in Kenya rearranged, redeployed about $45 million from its existing UN development assistance framework to support the Kenyan government. And besides that, launched a flash appeal on the 9th of April for $265 million. Besides that, we also launched an appeal for responding to the locust. Today, we are at about $100 million and are working with the government.
And on that philosophical note, thank you so much, Sid.